Magandang hapon po muli. Pagpapatuloy po natin sama-samang pag-aaral about blood or swe. Number 3 na po tayo. So, ang liver po yung nag-store ng blood. Yun po yung pangunahing role ng liver. So, kung tayo po ay gumagalaw, yung ating pong blood ay pumupunta sa ating mga muscles at sa sinews. So, kung tayo po ay nakahiga, yung ating pong blood ay babalik po sa ating liver. So, when active, blood circulate in vessels. So, kung pag nakarest tayo, babalik siya sa liver. Kaya po yung napakahalaga na, di ba yung time ng liver, tanda po natin yung ating liver time, dapat tulog po tayo noon, kasi kung hindi tayo natutulog ng 1 to 3, nagagamit po natin yung blood, kaya pagising natin sa umaga, nahihilo tayo. So, yun po yung ginagawa ng blood, pag nakahiga tayo, nakalay down, so in-store po yun ng liver. Okay. So, when lying down, blood regenerates itself in liver. Hence, importance of having adequate rest lying down in cases of deficient liver blood. Kaya may mga nag-anemic po. So, kailangan po nagpapahinga tayo, higa tayo, para yung blood natin ma-regenerates uli. Babalik siya sa liver para magkaroon tayo uli ng regeneration ng blood. So, blood is stored in liver. Siya po yung nagmamoisten sa ating eyes. Kaya kung ang ating liver ay kulang ang blood, malabo po ating paningin. Promotes good sight and moistens sinews. Promotes flexibility of joints. So kung okay yung blood natin na nakaimbak sa liver, pati mga joints natin, magiging walang disease. So blood flows to liver during sleep, so that when adequate supplied with blood, eyes can see, hands can hold, finger can grasp, feet can walk. O alam na po natin pag nahihirapan tayong gumalaw, pangunahin po niyan, ang liver natin ay may disease. Maaring siya ay kulang ng mga stored na blood. So when blood is harmonized, sinews are strong and joints supple. So, blood of liver supplies uterus with blood, closely related to penetrating vessel. Ito po yung chongmai. So, this vessel supplies uterus with blood, but this supply depends on provision of blood from liver. Kaya kung healthy po yung liver natin at maayos yung kanyang na-stored na blood, tiyak ang uterus natin ay healthy din. So, kung nagkakaroon ng problema sa panganganak, possible po yung liver ay may disease. So, this liver blood is extremely important for regular and healthy menstrual function. Kaya yun po yung iba rin po, di ba, nakakaranas na minsan delay menstruation or mens ng mens. So, yung liver pong organ ang ating dapat na natitreat. So, yung liver blood po, siyang nagno-nourish sa sinews, sa eyes, and nourish eyes and regulate uterus. So, yun po yung pangunahing function of liver blood. Kidney and liver have a common origin. So, ito po yung essence na nakastore sa kidney. Tapos yung liver stores and blood. Stores blood, nasa blood. Di ba pag kumain po tayo, then after na kumain tayo, digest, tapos pagkatapos po nun, magkakaroon ng yung daloy po ng pag-produce ng blood at ang pinaka-ano po role ng liver ay stored niya sa panahon na 1 to 3 na gabi, kaya dapat tulog po tayo noon. Then nadali niya sa heart para circulate. Kidney are mother of liver according to 5 elements. So essence and blood usually influence each other. Essence can be transformed into blood. Blood nourishes and replenishes essence. Kidney essence control reproductive function, and since it influences blood, blood also influences reproductive function in women. So, if liver blood is deficient, amenorrhea or scanty period, stagnant liver blood can cause painful period. So, yun, nagtataka minsan yung mga dalaga or yung mga babae, but nahirapan silang mag-mens. So, pag kulang po tayo ng dugo, Yun, nagkakaroon tayo ng konting menstruation o short period yung menstruation. At pag mayroong stagnant liver po, yun, yung masakit yung puson. Kaya ito po yung ating in-acupuncture para lumakas ang ating liver. Okay, menstrual blood originates directly from kidney essence. This matures into Tian Jiao during puberty. 14 for girls, 16 for boys. Menstrual blood is Tian Jiao and direct manifestation of kidney essence, in the same way that the sperm is for men. So, Tian Jiao is menstrual blood in women and sperm in men. It originates directly from kidney essence and it matures at puberty. Thus, although part of menstrual blood is more precious fluid because it derives directly from kidney essence. O, nakita po natin yun, yung menstrual blood. Direct pala siyang nanggagaling sa kidney essence. Kaya kung marami kang pinapanganak, yung kidney essence pala talaga ang nauubos. Okay. So, yung lungs naman po, assist spleen in sending food qi to heart, where it transforms into blood. Control all channels and blood vessels. So, ibig sabihin po nito, yung lungs ay nag-infuse ng qi sa ating blood vessel para i-assist po ito. Yung kidney naman po, it po yung nagko-contribute sa production ng blood sa dalawang pamamaraan. Yung original qi natin, assist in transformation of food qi into blood. Tapos yung kidney essence natin can be transformed into blood. So to nourish blood, we need to tonify spleen and kidney. So pag may disease po sa blood, kailangan po nating laging tutusukan tonification ng spleen and kidney. Heart, spleen, liver are most important with relation to blood kasi sila yung mga involved na organ. Yung heart, siya yung nag-govern sa blood. Si spleen, siya yung hold blood in the blood vessel. Tapos si liver, siya yung nag-store ng blood. Kaya itong tatlong organ na to ang related sa blood. Okay, thank you po.
Thank you very much, Ma'am Mildred. Let's now proceed to tongue diagnosis. Let's welcome Ma'am Teresita Sumile from Rizal. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector, at sa lahat na po. Welcome po sa tongue diagnosis. We are still on the continuation of tongue body shapes. This refers to the external form of the tongue. It is also called the tongue form. Normal tongue shape is neither too thin or too wide. It is soft and supple without being swollen. Its form tapers off toward the tip. There are no cracks on the surface. Clinical significance. Tongue shape is the outward manifestation of the tongue body. It reflects the condition of the zangfu organs. Observation of the tongue shape can provide more information than can be gleaned from the color of the tongue body alone. A change in the shape of the tongue body indicates a more severe condition than if the shape were unchanged. The shape of the tongue body helps provide a correct diagnosis when the color of the tongue body has not changed, especially when the tongue shape is grossly abnormal. Okay? Pathological changes in the tongue body shape. Changes in the tongue body shape include its texture, size, and surface. Okay? Now, as I said earlier, the changes in the tongue body shape include its texture, size, and surface. Now, as you look at the tongue, Let's be very observant on its texture, whether it is tough or tender. Then, the size of the tongue, whether it is enlarged or small. Now, now let's, if it is enlarged, ang pangalawa nating titingnan ay whether it is flabby, swollen, or with teeth marks. Then, the surface, whether it has prickles or fissures. So this is the best thing to do as a good TCM diagnostician, okay? Now let's go to the explanation of texture. The texture of a normal tongue body should be neither tough or tender. Identifying the toughness or tenderness of the tongue can help one differentiate whether the pattern is predominantly one of excess or deficiency. Then, pathomechanism of the abnormal tongue texture. The texture of the tongue body reflects the condition of the tongue muscle and membranes, which require nourishment from qi, blood, and body fluids. A rough tongue texture arises when excessive pathogens invade the body and there is exuberant antipathogenic qi. The battle between the antipathogenic qi and the pathogenic factors will be strong, causing the muscle fibers to bulge, which causes the stripe to become rough and coarse. A tender tongue is mostly associated with states of deficiency. If the qi and blood are deficient and unable to fill up or nourish the tongue body, causing the muscle fibers to become thin and atrophied, the surface texture of the tongue will appear tender. Or if the yang is deficient and unable to adequately transform the body fluids, then cold damp can accumulate in the tongue and cause its tender appearance. Okay? So this is an illustration on how the normal tongue body texture changes into tender tongue or tough tongue. Okay? Now, normally, qi, blood, and body fluids nourish the tongue. If there is sufficient qi, blood, and body fluids, the tongue body reflects a normal tongue texture. However, if there is blood or yin deficiency, or there is obstruction of damp or phlegm, the normal tongue texture will turn to tender due to lack of nutrition. Okay? Another pathomechanism changing the normal tongue texture into abnormal is when our antipathogenic qi is strong enough to fight the pathogens. This strong battle between antipathogenic qi and the pathogens causes the muscle fibers to bulge, thereby changing the normal tongue texture into tough. Okay? Now let's go to the explanation of toughness. The muscle fibers of the tongue body are rough and coarse. The tongue is striated like red meat. Now, this table illustrates tough tongue and its indications. Okay, in excess syndrome, tough tongue indicates either excess heat or blood stagnation. Now, in excess heat, the tongue body is red and tough, while in blood stagnation, the tongue body is purple and tough. This is due to excessive pathogenic qi invades and struggles with antipathogenic qi, causing the qi and blood to move upwards and the muscle fibers to bulge. Okay? Next is tenderness. The striae of the tongue are delicate, fine, and smooth. The tongue is smooth like skinless chicken breast. Okay? Now this table illustrates the tender tongue and its indication. Okay? In deficiency syndrome, Tender tongue indicates either Qi and blood deficiency or Yang Qi deficiency. In Qi and blood deficiency, the tongue body is tender and dry, while in Yang Qi deficiency, the tongue body is tender and glossy. The pathogenesis of this is Qi and blood deficiency can't nourish the tongue body, or a Yang deficiency cannot transform body fluids, giving rise to their accumulation in the tongue and the tender texture. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. So now marami na tayo natutunan about tongue body shape, no? Palalim ng palalim.
Yes po, Doc.
And we did not realize na superficial lang pala yung kaalaman natin. Anyway, so it may be a very long topic, but somehow it makes us appreciate what we're doing better. So let's now proceed to diagnosis by interrogation. And today, Ma'am Vina will start on a new topic, no? Mental, emotional problems. I think this is very, very relevant today. Mental emotional symptoms. She will talk about why we ask. Good afternoon po, Ma'am Vina, straight from Baguio.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, bago nga po itong ating topic. So, mental, emotional symptoms po. Why we ask. Ang area po ng pagtanong surrounding the emotions experienced by the patient ay importante po, if not the most important area. Emotional causes of disease play a very prominent role in the etiology and clinical manifestations of most karamihan po ng mga pasyente. Therefore, we should always ask patients about their emotional life. However po, some patients may regard an inquiry about their emotional life as an intrusion, and we should be sensitive about this. So, ingat po tayo sa pagtatanong. Ang emotional state po ng pasyente reflects, of course, yung state of his or her mind and spirit. And the findings from interrogation need to be carefully integrated with those gleaned from observation. Particularly, observation of the luster sa mga mata niya, yung shen, at idagdag po natin yung state of the patient's mind and spirit is an important prognostic factor. So when we asked, inquiry about the patient emotional life must be closely integrated with observation. Especially nga po sa kanyang mata, sa kulay ng kanyang balat at saka ang kanyang dila. With palpation sa pulso at saka yung yung pakikinig po sa kanyang boses. Pag yung emotional condition is not the presenting problem, sabi po ng author ay, ang tinatanong daw po niya sa pasyente ay emotional life towards the end, so sa last na of the consultation, para ma-find out po yung sanhi ng kanyang sakit. In many cases, the emotional state of the patient is the main presenting problem. For example, pag yung pasyente po ay may come to us because they are depressed or anxious. In other cases, the emotional state of the patient is the underlying cause of physical symptom. For example po, pag yung patient may complain of tiredness and digestive symptoms, when frustration and resentment may be the cause of the condition. So unless the patient comes specifically seeking help for an emotional state such as depression or anxiety, ang ginagawa po niya ay tinatanong niya yung pasyente, ang emosyon ng pasyente, when the pattern emerging from the interrogation. Together with observation of the eyes, yung dila at saka yung palpation po ng pulso. And it strongly points to an emotional cause of disease. For example, sa lung pulse po is somewhat full and the patient looks sad. So, ang sabi po niya, I may try to find out whether he or she has experienced sadness or grief na hindi po niya ma-express. The fullness of the lung pulse would indicate this. So, sa pulso po, pag full. Pag yung heart pulse naman is overflowing and there's heart cracks sa dila, so sabi po niya, I may inquire whether he or she had suffered from a shock. Pag yung lung pulse is particularly weak and without wave, at saka yung kanyang mata ay kulang ng luster, I may explore whether events in the patient's life have caused, pag ito po yung sanhi ng kanyang kalungkutan or grief. Pag yung puso naman is wiry on all positions, tatanungin daw po niya yung pasyente kung whether some situation in his or her life is causing frustration, galit o kaya resentment. At pag yung heart pulse is choppy, the complexion dull, tapos yung kanyang mata ay lusterless and mahina po ang kanyang boses and para pong naiiyak. So, sinusubukan niyang i-determine whether the patient is sad. On the basis naman kung ano yung na-find out niya sa kanyang observation, palpation, and hearing, tinatanong niya yung patient to confirm the presence of emotional problems. Importante po ito to engage the patient more with the treatment and by making the patient aware of a possible emotional cause of the symptoms. It may further the healing process. Importante po to be sensitive pag magtatanong po tayo ng question about emotional state of the patient. Pag hindi naman po ito yung presenting problem, often observation gives us a clue about the emotional state of the patient. In which case, sinasabi po niya sa patient niya about it. For example, a patient may come in complaining of parang napapagod siya and my premenstrual breast distension. If the patient eyes ay kulang po sa kinang, I would suspect emotional stress to be the cause of the problem, sabi po niya. And I would circumspectly sumaingat siya sa pagtatanong ng pasyente about it. It is important to mention, however, that in most cases of treating emotional symptoms or symptoms which are caused by emotional problems, yung observations po should take precedence over what a patient verbally reports. It is most often when we see beyond what the patient is telling us that we find the true cause of a disease. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. So I'm sure maraming, to be honest, there are so many patients na may mga emotional, mental issues, no?
Yes, Doc.
Yeah.
Tapos pag nagtatanong talaga tayo minsan, maging sensitive tayo sa kanila kasi minsan kung hindi pa po sila healed, mahirap anuin. Talagang yung iba po hindi umiimik pero yung iba iiyakan ka ng iiyakan.
At saka dapat, nandun yung trust nila, hindi nila nakikita
Opo.
na marites tayo, di ba? Yun.
Opo. Kaya nga po yung clinic natin dapat talaga merong corner para sa pasyente na hindi nakikita ng mga
May
talagang
privacy. Okay, so thank you very much, Ma'am Vina. Now let's go to Paul's diagnosis. And Ma'am Mildred will now discuss the 3 positions. Good afternoon po ulit, Ma'am Mildred.
Magandang araw po muli. Ang ating pulse diagnosis, number 84 na po tayo, the 3 position. The 3 position. The pulse is felt in the 3 position on which wrist, in each wrist. So sa ating pong sa ating kamay, sa wrist. The distances between the position depend on the size of the patient body. So one must align the fingers in a way that is relative to patient anatomy. So kailangan po nating sinusukat yung fingers ng pasyente kasi minsan baka mas malaki yung fingers natin, baka may mas maliit. So tatansyahin po natin na kasing laki ng fingers ng pasyente bago natin makikita natin yung yung distance. In small children, it may be necessary to use only 1 or 2 fingers to feel the pulse. So, yung malilit na bata, syempre malilit pa yung fingers nila eh. The 3 position are named Kun, Guan, and Qi. In Chinese, which translate in ins, gait, and foot. Yun yung Kun, ins, or gait, and foot, respectively. Their names are derived from their location. Ins and foot being units of measurement and a gate connecting these 2 positions. The middle or guan position is located on the radial artery medial adjacent to the steroid process. The front or kun position will be 9/10, 9/10 of a kun. Distal of the guan position. So proximal to the crease in the wrist at the base of the tenar eminence. The rear or Qi position is 1 kun proximal to guan position. So pag dinikit-dikit mo lang po yung fingers mo, batay dun sa size ng pasyente, siya po yun. This means if you place the middle finger on the artery next to the lung 8 and the index finger on the tune position proximal to the wrist, the ring finger will be placed approximately almost the same distance from the guan position. So yan, yung mo po yung fingers, didikit mo lang yung mula sa hintuturo, sa Tagalog po hintuturo. Tapos palasingsingan, tsaka yung kasunod po niya, before yung pinakamalit nating fingers. Ito po yun. Okay. So yung Chinese name at saka equivalent to English name. So yung kun po, ito ay inch. Yung guan naman, bar or gate. Yung Qi is foot. So it is important not to have rigid idea of a pulse. Position significance. So yung pulse po reflect changes throughout the body in the organs. Yung channel and Qi at saka yung blood, ibig sabihin po that changes occurring in the same pulse position will have different connotation when seen in different contexts. So iba-iba po yung nararamdaman natin dun sa mga organ na yan, hindi po yan nagpapare-pareho. Pero minsan, halimbawa yung isa ay fast, nagpa-fast din yung isa, pero yung minsan may nag-slow. So mararamdaman natin at makikita kung anong organ. Like so much on Chinese medicine, it is the context that in the defining factor, for example, other symptoms and signs that are present and the prehistory leading up to the situation. When one understands the pulse position as being reflection of the 3 jiao, alam natin yung 3 jiao po ano, yung upper, middle, and lower burner natin. Instead of being a temple of the organs and channels location, it's easier to reconcile the different models. If the pulse is, for example, superficial and tight in the right kun position, and the patient has a shoulder pain, so pag right position po ay, di ba, yung lung, spleen, kidney, yang. So the pulse will be reflecting a disturbance of the large intestine channels, and therefore treatment of the large intestine channels would be relevant kasi yung large intestine is a partner organ of the lungs. So if the pulse has the same quality and the person has been exposed to wind and cold, they have an aversion to cold and feel tired and have sore muscle. The pulse will tell you that there is an invasion of pin cold, lacking Wei Qi, which is yang aspect of the lung. The same pulse could also be seen when there is toothache, headache, tightness, or chest, or something else. So alam natin pag wind cold, mabagal po ang mararamdaman natin na pitik ng pulso, mabagal kasi may lamig. Pag wind naman po, yung wiry, nararamdaman natin yung wiry. Yung wiry po para siyang, di ba yung string ng gitara, pag nag-ano kayo, nagbabibrate siya. Yun. Initially, it can be difficult and confusing to remember all the different vision of the pulse. Some people start by just learning one of the pulse models. So it is important though to remember that there are other models. So if pulse is not consistent with what one expects to feel, it may well be because the pulse is reflecting another aspect of the body's physiology. So, kailangan talagang pag nagpa-pulse po tayo, nakakonsentrate tayo dyan kasi iba-iba nga yung mararamdaman mo. Then, may gusto kang malaman dun sa pasyente mo na hindi mo nararamdaman sa pulse. So, titingnan mo po dun sa ibang aspect din. Tingnan mo yung tongue, tapos dun sa iyong interrogation, plus history. Para makonek-connect mo po siya na magtama yung iyong pagtingin sa pulse. So, the three horizontal pulse position can also be seen as a reflection of yin, yang, and blood. So, yung level ng yin, yung lamig ng katawan, at init yung yang, at yung level ng blood. In the same way, as the three levels where changes in yang and yin will affect the kun and qi position. So, yung kun is yung sa taas na level po, tapos yung qi ay yung sa babang level. So, position respectively and changes in blood will affect the guan position. Tuloy po yung pulse position, yung chun, guan, qi, yung type of qi, pag kun, qi, yang, sa upper po ito, pag guan, yung blood, middle, and qi is yin, lower part or jiao. So, the following are four of the best known presentation of pulse position from different historical textbooks. Basta yung parang lang po niyan, sa yung level ng Chungguan Qi, may mga katapat siyang mga organ. Ito po yung makikita natin. Nanjing, the classic of difficulties. CA 100 CE. The pulse position are defined by the channel pairs in relation to 5 phase sa Xiang cycle. So pag kun, yung level po ay superficial, pag sa left, hantay yang, or yung small intestine yung makakapa natin na organ po Pag sa right naman, Han Jiangming, large intestine. Yon. Tapos sa deep, pag dininan po natin, Han Xiaoyin or heart. Then, ang makakapa natin sa right ay Han Taiyin lang. Then, pag sa gitna naman po yung sa guan, ang makakapa natin sa superficial ay gallbladder. Then, sa right naman po ay stomach. Yan, right is stomach. Sa deep level po ng guan ay yung liver. Foot yin. Pag sa right po ay spleen. Yung deep level po yun Ang nakakapa natin sa superficial ay yung yin yang organ. Yung partner organ ng yin. Tulad po yan, kung nakita nyo yung spleen, ang superficial niya ay stomach kasi siya yun yung yang organ. Okay. Pag sa qi naman, superficial level, so ito yung partner organ ng kidney, foot taoyang o urinary bladder. Sa pag-deep po, kidney. Pag diniinan mo, sa kidney pala siya. Then yung right naman po, itong triple burner o sanjiao. Hanjiao yin, pericardium ang partner organ niya. So ganun po mas natin na pag mababaw yung ating pagpatong ng kamay, ang una mong mararamdaman ay yung partner organ ng zangfu. Yung zang. Okay po, thank you. Talagang pag nagpa-pulse diagnosis po tayo, talagang kailangan ipapractice para masaulo natin at talagang makapa natin yung mga dapat nating maramdaman.
Yeah.
Sa simula po, at least yung basic muna na malaman natin yung hot and cold, yung pag malamig, pag malamig, mabagal ang pulso. Pag mainit, mabilis yung pulso. Sa mga nagsisimula po, yun na muna yung basic na dapat nating matutunan.
Yung pinakauna talaga is malaman mo kung mabilis yung pulso. Kung mabilis siya, heat talaga yon. So doon ka na medyo, noon mo na inanaro yung
Opo.
yung nasa ulo mo.
Opo. Tapos yung organ, mahalaga doc na masaulo natin kasi alam mo nga, heat or cold, may paspal siya or slow, nasa ang organ to. Para makatulong na po kung anong organ yung hinahanap mo na dinadiagnose mo.
True. Maraming salamat po, Ma'am Mildred. So, tuloy-tuloy na po ito. Sana hindi magsawa. We will try our best to really make this webinar very...
Opo, para ma-review tayo lahat. Kasi kailangan kong binabalik-balikan talaga.
Yeah. So from pulse diagnosis, we will proceed now to lump TCM foundation sa may differentials. Let's call again on Ma'am Neats, who is busy now, out of town. Good afternoon, Neats.
Good afternoon, everyone and classmates. Welcome to our TCM Foundations number 185, Stagnation or Binding Depression of Liver Qi. Okay? So, yeah. Etiology, yung cause po, prolonged emotional disturbance like a state of frustration, repressed anger or resentment over long period. So, observe natin kapag ka may problema sa liver, no? Mayroon siyang kinikimkim. Matagal na, hindi na ilalabas. Okay? Underlying and or accompanying pathology, kidney deficiency, liver blood deficiency, and spleen Qi deficiency. Okay? Ang sign and symptoms ng may mga ganitong pattern, melancholy, malungkot, mayroong depression, may pagka-moodiness, hindi maintindihan yung mood. Minsan, mainit ang mood, minsan malamig, okay? Hypochondrial and epigastric distension, medyo malaki, yeah, okay? Feeling of oppression of the chest, sighing, irritability, premenstrual tension, irregular periods, premenstrual breast distension, plumstone throat, yung parang may bara, jaundice, naninilaw, and epilepsy. Okay, remember po yung mga symptoms na yan. Okay. Pulse, it is wiry. Yan, pagka wiry, alam na natin, liver. Yung tang kapag tiningnan mo ay normal or slightly red sides. Yung sides kasi andun yung liver. Okay? Treatment principle, course liver, rectify Qi, resolve depression, harmonize liver, and spleen and stomach. Yan. So, ang acupuncture treatment points na gagamitin natin po ay pericardium 6, regulates liver Qi, liver 13, harmonizes the liver and the spleen, liver 3, courses liver Qi. Okay? Bladder 18, remember po, bladder 18 disperses liver stasis. May stasis stagnation. Gallbladder 34 courses liver Qi. Liver 14 harmonizes liver and stomach. Sanjiao 6 or triple warmer 6 regulates liver, eases hypochondrium. Okay? Pagka may mental depression, point po natin ay heart 7 and GV or DU26. Okay? Sa may, ano yun eh, dito sa may bibig. Tingnan na lang po natin ang points. Sa may oppression sa chest, REN 17 or CV17. Okay? Kapag may pain and distension in lower abdomen, gamitin nyo ang liver 5, liver 6. It's either. Okay. Kapag may plumstone throat, parang may bara yung throat na plumstone,
Nawala kayo, ma'am. Mukhang nawala yung signal.
Baka po nawala ang signal ni Ma'am Neats.
Oo nga.
sa breast, for breast pain, REN 17, liver 14. And for needle with even method and moxa. Dok, nawala ba?
Nawala saglit, pero okay na.
Okay. Ang technique ay needle with even method and you can use moxa. Medyo mahina signal, tsaka maingay. Dinig ba, Dok? Hindi naman?
Dinig po, dinig. Oo.
Yung ingay, okay. Salamat po.
Hindi
Thank you
naman,
very much,
hindi
everyone.
dinig yung ingay. Siguro may noise
Talaga?
cancelling yung ano mo.
Ayun,
Okay.
may headset ako.
Yeah. Thank you so
Thank
much,
you po, Doc.
Ma'am
Thank you po.
Neats. Thank you very much. Napaka-common po itong liver Qi stagnation. And there are so many patients na hindi sila aware na ito pala yung problem nila. no? So
Ang
thank
dami
you for,
kasi, Dok, stress sa buhay ngayon eh.
yes.
Diba?
So kailangan meron tayong program na at least kahit papano mawala yung stress, no? Okay, yung iba dyan, katulad ni Ma'am Teresita, kailangan na niya maghanap ng partner na bago.
Kaya nga po,
Ako
lilipad siya
yun.
sa Baguio pangalis ang stress.
Yes.
Ma'am Vina, hanapan mo ko sa Baguio, ha?
Diba? O sige na.
Sige po.
Okay. So, from differentials, punta na po tayo sa acupuncture patterns and practice. And today, we will start with abdominal pain. Very common po yan. The abdomen refers to the anterior trunk, which includes the extent from the epigastrium to the pelvic bone. Okay, yung abdomen natin is subdivided into regions that are not precisely demarcated. So puro palpation ginagawa natin. The epigastrium principally relates to the stomach. No? The large central region principally relates to the spleen and the intestines. The middle lower abdomen principally relates to the kidney, urinary bladder, large intestine, and the domains of the Chong and Ren. The two sides of the lower abdomen principally relates to the liver meridian and the large intestine. So your abdominal pain relates mainly to exogenous evils, no? Intemperate diet, passions, or deficiency of the visceral yang. Now let's talk about the exogenous evils. So when the exogenous cold and wind attack the middle jaw, by the way, yung cold sa wind, parati yan sila magkasama, no? So they attack the middle jaw. So ang cold po, pag may cold, pag ang cold kasama ni wind, the cold will gel in the interior. So pag nag-gel po yan, it will block the stomach in the intestines. Or kumain ka ng maraming raw food and cold food, no? This will injure the middle jaw yang. Qi movement is impaired, so yung ascent and descent become abnormal. Tapos, lumalakas po yung yin cold in the interior. So in all these cases, Qi movement is blocked. So pag may blockage po, meron po tayong pain. Excessive exposure to summer heat, as well as dampness, invading and lodging in the middle jaw, can also disturb stomach and intestine functions and lead to pain. Okay? Yang deficiency. Several circumstances can result in chronic deficiency of yang qi. So depression of spleen yang. So there will be loss of motive force for TNT, no? Transportation and transformation. So such loss of nourishment, so kulang ng nourishment, so ngayon yung visceral organs are insufficient. They are at risk now for production of endogenous cold. Ibig sabihin ng galing po sa loob, na galing sa interior. So depletion of middle jaw yang, syempre kulang, it will actually welcome with open arms yung cold and dampness sa middle jaw. So pag pumasok po yan si cold and dampness, that will cause blockage, no? So insufficiency of qi and blood means kulang po ng nourishment ang visceral organs. Okay? Pag kulang naman ng genuine fire, no, it will permit endogenous cold to form, and so magkakaroon po ng qi and blood deficiency, and so this will fail to nourish the visceral organs. So in these circumstances, abdominal pain can also result kasi nga kulang eh. Intemperate diet, I think this is one of the most common causes, no? Overeating, lalo na pag libre, di ba? Kakain ka talaga ng madami. Injures the middle jaw. This can lead to food retention and the formation of endogenous heat. Kasi nga may retention, so magkakaroon ng heat. So this will cause blockage of the stomach and intestine qi. Excessive fats or spices will facilitate the interaction between dampness heat and retained food, and this will induce impedance of qi movement. Rotten or unclean foods also injure the spleen and the stomach. So all of this can lead to abdominal pain. Passions, rage, and depression can injure the liver and will cause blockage ng normal path for liver qi movement. Pent-up liver qi will then move abnormally. So this will impair the functions of other visceral organs. So magkakaroon po ng Qi stagnation and blood stasis. So this will produce abdominal pain. Less common causes ng abdominal pain, we have malnutrition, dahil meron kang alaga, parasitic infestation. It can also be caused by kidney insufficiency with anuria, hindi umiihi, no? Kulang yung ihi, and abdominal masses. The illnesses that present with abdominal pain also fall in the two categories of strength and deficiency, o yung excess and deficiency. So pag sinabi mong excess, ito yung caused by exogenous cold, dampness or heat, or food retention. And this will lead to impedance to qi movement and blood flow. Deficiency illnesses due to deficiency of visceral qi with endogenous cold, so ibig sabihin ng galing po sa loob, and kasi nga yung deficiency, inability of the qi and blood to warm and nourish, no? So yun lang po muna. We will continue po tomorrow with
may dagdag ako, Doc. Yung
Sure.
nauuso ngayon na ano po, itong eat all you can, talagang magda-damage po sa spleen stomach ng maraming tao kasi 'di ba, kung katamtama lang ang kakainin mo, katamtamang energy, blood lang yung gagamitin ng katawan. Eh dahil uso ngayong eat all you can na hindi na kaya, sige pa kasi nag-arimuhan, 'di ba? Ngayon
No,
na nasosobrahan po yung katawan.
alam mo kasi, mga tao, hindi naman lahat, no? Pag alam nila eat all you can, kakain sila nang hindi nila kaya lang. Yung talagang hanggang sa hindi na sila makatayo. Yun, parang lulubos-lubusin.
Kaya
No?
nga po.
Katulad ng isang patient ko nung ina-aculift ko, tapos ang daming lumalabas na oil sa muka. Sabi ko, sir, medyo bawasan nyo na yung pagkain ng ano. Eh parati, ano siya, magra-run siya for Congress na next elections. So he gets invited, pag nag-hotel siya, talagang yung mga 5-star, no? So syempre, pag kumain ka sa mga buffet, sabi ko, pagkakain ko sa buffet, sir, wag mo makain. Eh paano, 3,000 yung buffet? So kakain talaga ako ng super dami. Yung mga ganon.
Hindi nabawi.
Kahit hindi na kaya, kakainin talaga. Talagang
Pero
susunod.
pero kung alam nila na binabawi nga nila, ang kasunod nun, magpapagamot sila ng ganun din karami dun sa kinain nila.
Totoo. But anyway, sige lang, it will take time siguro. Diyan naman nila marirealize eh. No?
Pwede naman po mag-itulukan ka, pero yung talagang kaya lang ng katawan. Piliin mo na lang yung healthy food, pati
Oo.
dun sa daming ano yun, kakainin.
Totoo.
Kung magkasakit na, doon pa nila ma-realize na mali pala yung ginawa nila.
True.
Eh,
Sige.
masarap daw po eh, kaya kahit mali, sige lang.
Oo.
Masarap kasi eh.
Okay, so from abdominal pain, punta naman tayo sa lips. And let's listen to Ma'am Teresita Sumile for signs and symptoms. Good afternoon po ulit, Ma'am Teresita.
Yes po, Doc. Good afternoon ulit and classmates. Signs and symptoms of pale and red lips. Let's take up first pale lips. In deficiency of qi and blood of the spleen, signs and symptoms are pale lips, dull pale complexion, poor appetite, slight abdominal distension after eating, tiredness, lassitude, weakness of the limbs, loose stools, thin body, scanty periods or amenorrhea, insomnia, joint ache, pale tongue, and has weak or choppy pulse. Sa liver blood deficiency naman, signs and symptoms are pale lips, dark pale complexion, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull pale complexion, pale tongue, and choppy or fine pulse. At sa spleen yang deficiency with empty cold, Signs and symptoms are pale and slightly bluish lips or bright white lips, pale complexion, poor appetite, slight abdominal distension after eating, abdominal pain, tiredness, lassitude, weakness of the limbs, loose stools, feeling cold, cold limbs, pale and wet tongue with deep, weak, slow pulse. Now let's go to red lips. In full heat, signs and symptoms are red and swollen lips, thirst, dry stools, feeling of heat, red tongue with yellow coating, overflowing rapid pulse, heat in the heart, lungs, stomach, liver, kidneys, and spleen all may cause red lips. Other symptoms and signs depend on the organ involved. Okay? Immune deficiency with empty heat, signs and symptoms are red, cracked, and dry lips, dry mouth, thirst with a desire to drink in small sips, feeling of heat in the evening, night sweating, pipe palm heat, red tongue without coating, floating empty and rapid pulse, empty heat in the heart, lungs, stomach, liver, kidneys, and spleen all may cause red lips. Other symptoms and signs depend on the organ involved. Okay? In invasion of wind heat, signs and symptoms are red lips, especially in children, aversion to cold, fever, sore throat, headache, body aches, slight sweating, tongue with red sides and or front, floating rapid pulse. Now, in acute heat at the Qi level in febrile diseases, signs and symptoms are red and swollen lips, fever, a feeling of heat, showing of bedclothes, thirst, profuse sweating, red tongue with yellow coating, overflowing rapid pulse. In acute heat at the Qi level in febrile diseases or fire, signs and symptoms are red, swollen, dry, and cracked lips, fever, feeling of heat, thirst, dry mouth, dry stools, dark urine, mental restlessness, red tongue with dry, dark yellow or brown coating, deep, full, and rapid pulse. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, next we go to a new topic, Atrophy Syndrome. And we have Ma'am Vina Pasqua of Baguio to present it. Good afternoon po, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, Day 1, Atrophy Syndrome, Etiology. Atrophy Syndrome, the earliest discussion of Atrophy Syndrome of a simple question. There it is called Wei Bai or Wei Bi. The Chinese term Wei means weathered or kay nalalanta. And in Chinese medicine, it refers to a condition characterized by a withering of muscles, sinews, and channels from lack of nourishment. The term bi or B, different character from B of syndrome, suggests inability to walk because the foot cannot be lifted properly. Thus, atrophy syndrome is a condition characterized by a weakness of the four limbs, progressively leading to atrophy. A limp state of muscles and tendons, an inability to walk properly, and eventually, naglilid po ito ng paralysis. This weakness generally occurs without pain, multiple sclerosis, and the paralysis following an attack of poliomyelitis are example of atrophy syndrome. Etiology. Atrophy syndrome, one for each yin organ and its release tissue, that is atrophy syndrome of skin, so sa lungs, muscles sa spleen, blood vessels sa heart, sinews sa liver, and bones sa kidneys. Yung libro po, the book attributes each of these to heat drying up the body fluids at naglilid po ito to withering of skin, muscles, blood vessels, sinews, and bones. Although this classification of atrophy syndrome is not generally followed any longer, it is still significant as, for example, sa pag nag-start pa lang, so beginning stage, atrophy syndrome is characterized by injury of skin and muscles, and therefore lungs and spleen. And in pag late stage naman na po, by deterioration na po of sinews and bones, and therefore of liver and kidneys. Yung idea po na heat drying up body fluids and injuring muscles and sinews is also important. Poliomyelitis is a case in point as paralysis follows to febrile stage. Pag yung heat dries up the fluids at naglilid to malnourishment of muscles, sinews, and channels. It will also be observed that in those suffering from multiple sclerosis, yung sakit po is often aggravated by a febrile disease. However, hindi po lahat ng type of atrophy syndrome is caused by heat. It also describes atrophy syndrome due to invasion of dampness in the bright young channels. This is a very common type of atrophy syndrome. Ang anim po na main etiological factors are as follows. Wind heat from a warm disease. A warm disease is due to invasion of wind heat. Pag yung pathogenic factor is particularly virulent, viral, and infectious. Although every warm disease is due to wind heat, hindi po lahat ng invasion of wind heat is a warm disease. Such a disease is due to an infection pathogenic factor that enters via the nose and mouth and is particularly strong. Measles and poliomyelitis are example of warm disease. Wind heat from a warm disease is therefore particularly strong, invades the body rapidly, and has a strong tendency na matuyo po yung body and fluids and the yin. Pumapasok po via the nose and mouth and naapektuhan po yung lungs and stomach. After the initial stage, it quickly changes into interior. Heat burning the yin of lungs and stomach. So yung drying up the fluids leads to malnourishment of muscles, sinews, and channels, and therefore paralysis. So poliomyelitis is an example of the pathological process as in fact the paralysis appears after the febrile stage. External dampness. It is a very important and common etiological factor, especially in atrophy syndrome. Ito po yung one explanation why the incidence of multiple sclerosis is among the highest in the world in the British Isles where the weather is extremely damp. So dito sa libro, it's a simple question na sinabi, when the air is very moist and the person has a predisposition to dampness, the moist air will invade the body and settle there. If the person also lives in a damp place, his or her muscles are invaded by dampness, and this will lead to numbness and in atrophy syndrome. So dampness is contracted from living in a damp house or being exposed to damp weather for a long period. It invades the muscles and sinews, causing a feeling of parang mabigat po ang pakiramdam and numbness, and in time causes them to weather and become paralyzed. So parang nilalanta po siya. Irregular diet, excessive consumption of dairy foods o kaya grassy foods o kaya pagkain na irregular. It may impair the function of spleen at naglilid po ito ng formation of dampness. If this settles in the muscles, which it has the tendency to do so, nagkukos po ito ng numbness and a progressive weakening of the muscles. Then next, excessive sexual activity and overwork. Pag sobra po yung sexual activity in men at working too hard, nadideplete po yung kidneys at saka liver. And therefore, humihina po yung bones at saka yung sinews. When these are deprived of the nourishment of the kidney essence and liver blood, mahina po siya or humihina and may eventually lead to atrophy syndrome. Ito naman, next ay trauma. To the head may cause stagnation of qi and blood in the area controlling the motor nerves and may lead to numbness, tingling, at saka weakness of the limb. Ang next naman po ay shock. Emotional shocks deplete heart and spleen. The spleen controls the muscles and the heart controls the blood vessel and circulation. Pag yung heart and spleen are depleted, the muscles becomes weak and circulation of blood to the limbs is defective na po. At sanhi ito or contribute to the development of atrophy syndrome. Sabi ng author, in my experience, I have frequently found that a shock precedes the onset of multiple sclerosis. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Do we have any questions?
Ma'am Bina, madalas pong
Apo.
tinatanong din ng pasyente pag nababanggit natin yung excessive sexual activity. So tatanungin nila, ilan ba ang dapat, paano? Di ba? Tinatanong po yun eh.
Ganun po, ma'am. Tanungin natin si Doctor kung ilan dapat. Minimal lang.
Depende po sa age, no? Kasi pag medyo hindi na tayo bata, you should realize na hindi na ganun kaganda yung essence. So, yun. And you cannot expect to be doing it as often as nung bata pa.
Patay po sa kakayanan ng energy na nila po. Pero yung iba naman po, kahit wala nang energy, dahil laging nag-hit, may mga ganun pong pasyente, Dok. Ang nipis na nga lang ng katawan pero kukwento ng asawa niya, ay naku, lagi yan nakakalabit. Pero nakaka-apekto din po yung hit na yun sa katawan nila, no?
Wag lang magpalabas kasi nauubos yung essence.
Opo. Siguro yun na lang ang mapapayo natin pag ganon. Eh kasi yung, di ba, may ano naman pong nararamdaman sila, di ba, pag yung positive energy during sexual intercourse, so mas lumalakas din yung katawan ng iba. Basta ano lang, huwag kayong magpalabas kasi dun yun sila pwedeng manghina.
I remember meron akong isang diabetic male patient, 48, no? So nung tinitreat na siya, siguro third or fourth session, sabi niya, medyo bumabalik na naman yung gana. Ibig sabihin, andun na naman yung yung kanyang sexual appetite na nawala. But I had to caution him. Sabi ko, nung bumalik yan, medyo dahan-dahan.
Opo.
Hindi na katulad ng dati. Okay?
Meron din kami, Doc, naging mga pasyente po ganun. Dati sabi nung asawa, talagang wala na silang gana. Pero nung na-acupuncture po siya, tuwang-tuwa yung asawa nung nagkwento. Sabi niya, bumalik. O ang mahirap lang po nung pinangwento, dumami yung pasyente kasi gusto na rin nila lahat magpa-acupuncture para may gana. Ay, nako.
Yeah. Anyway, ganun talaga. Pag hindi
Sabagay, kasi iinom sila, Doc, ng mga pampagana, acupuncture na lang.
Oo, accept na lang. Ang nakakatakot dyan, yung gumagamit ng pampagana, kung yin deficiency yung pasyente mo, it will give negative effects po.
Meron nga po, Doc, di ba, may nabibili. Minsan, online lang nila bumili, pang
Yun ang
patigas
risk
daw.
ngayon.
Kasi mga matured naman yung tagapakinig natin ngayon. Ngayon po, hindi na lumambot. Yun ang problema niya.
Oo, grabe yung heat.
Lagi na lang nakatayo.
Yes. Anyway, so with that, we would like to thank...
yung Doc, para lumambot uli.
Opo. So thank you very much everyone for joining. Hope to see you again tomorrow po.